Welcome to the Science of Skin Health on Legends 100.3, brought to you by Joanne Francis Medical Aesthetics Spa, helping you put your best face forward. Here's Mike McGann and clinical esthetician and licensed skincare specialist Joanne Francis.
Good morning and welcome to another edition of the Science of Skin Health right here on Legends 100.3. The Science of Skin Health is brought to you by Joanne Francis Medical Aesthetics Spa. Mike McGann with you along with clinical esthetician Joanne Francis. Good morning, Joanne.
Good morning, Mike, and listeners again.
Always so. I enjoy this show so much because I come out learning so much as we go through. And, you know, we've covered a lot of really interesting stuff just in the couple of shows we've done already. But we were chatting a bit about today's program, and it's really interesting. And I'll explain why that is in just a minute. But I want to give you some contact information as well because, I mean, Joanne Francis does so much at Francis Medical Aesthetics. There's a lot you can do. And the phone number is 561-616-1001, 561-616-1001. And the website is francismedaesthetics.com. That's Francis Med, M-E-D, Aesthetics, ESTHETICS.com. And if you have any questions for Joanne, things you'd like us to address on an upcoming program, send that question to Joanne, Joann, at francismedaesthetics.com. Okay, so Joanne, we've talked about a lot of very interesting stuff, but today's really fascinating. What's today's show all about?
Today is about a healthy skin barrier. Now, every week, it's kind of like my shows are continuing with knowledge.
Yes.
So I do want to say, if anybody missed any of the past shows, we are posting them on our website, so you can actually listen. And that kind of fills you in. But I'll be repeating some things from past shows to bring it forward, so you don't have to, hear it from last week. But that way, the knowledge is my passion to give, because people work hard for their money, and we don't want to throw it away.
Well, yeah, I agree completely with that. And but certainly that's wonderful that the shows are up at francismedaesthetics.com. Track them down and listen to them again.
So a healthy skin barrier. And again, the show is so much full of knowledge, probably going to have to run into a part 2 next week.
Okay.
But so now that we know from last week's show what happens to our skin with every decade, now I want to break it down a little bit to get to the causes and how to correct the effects that we see. So why is it important to have a healthy skin barrier function? Well, Dr. Zain Obaji, as I base my knowledge with him on his Science of Skin Health, says it would be hard to overstate the importance of an intact barrier function in skin health. So what is the skin barrier that I keep referring to? Our skin barrier is our protection from the outside elements. And again, as we know, the skin is the largest organ of the body. As a clinical esthetician, that's my specialty.
Okay.
Again, what is a healthy skin barrier? Skin health is defined as smooth, even in color, firm and tight, well hydrated, tolerant, contour rich, and free of active disease. But what happens when our skin barrier is compromised? The skin's normal barrier function depends on a 6-week cell turnover cycle. As an adult, this cycle is the foundation of skin health restoration, because without adequate epidermal exfoliation, remember that GSR, and subsequent replacement of fresh active cells, skin health is compromised.
And I've got to tell you, I mean, that GSR, one thing to say about it, remember, it's to cleanse twice a day and exfoliate once a day. And yeah, that's a lesson I certainly learned, and it's made a difference.
So I've created another expert in the field because you got it.
Well, I don't know if expert's the case yet, but I certainly am using some of the products, and it really is something to see, because my skin is starting to hit some more of those points, especially smoothness, and this is just the GSR aspect of it. So it's so interesting to see what's going on. But we're talking about the skin barrier, what happens when it's compromised, and really what that does to our appearance.
Yes.
What happens?
Well, a
then?
compromised skin barrier, it ages our appearance.
Okay.
So how do we repair the barrier function of our skin? By following Zeo Skin Health restoration principles. I have been and continue, Mike, to study Dr. Obaji's science because he continues developing all that is new so I can bring to you your best results at Joanne Francis Medical Aesthetics.
It's so important, too, because what you just mentioned is that Dr. Obaji continues developing things that are new. And that, to me, shows that science is science,
Exactly.
and science is never static. We never have all the answers from a scientific standpoint. So Dr. Obagi continues to refine, continues to learn, continues to build on the principles.
Right. And it does go, you're right, with the principle of any science.
Yes.
You never stop learning and
Ever.
it never stops growing.
Correct.
And I have to say on that note, I have great news to share.
Okay.
I have been recognized by Dr. Zain Obagi with placement on the ZO crew.
All right.
It's an elite team of 20 skincare experts nationwide.
Wow.
I was selected from over 1,700 accounts nationally. There were many factors that led up to me being one of the 20 chosen, including, but not limited to, my well-versed understanding of Dr. Obagi's ongoing and ever-changing science of skin health. All who know me quickly realize that the well-placed protocols that he has come up with is the difference between everyday skincare and complete skin transformation. So I'm being flown out to Beverly Hills to meet with and spend 2 days studying directly under Dr. Zain Obagi. Now, I've met him over many years.
Sure.
I've been working with his science for 19 years. But this is to continue my dedication to your skin, and again, as many who know me and have been under my care.
And I got to say congratulations on that.
Thank you.
Joanne Francis, 1,700 nationally, and Joanne, one of the 20 chosen. And that says so much
is
for,
big.
It's huge. It's huge for you. But what does that say also for the level that you are at when it comes to skincare and skin health? And you can learn more about it. And by the way, set up a free cosmetic consultation too. That's a great benefit anyway, to work with someone like Joanne, who is recognized as being one of the top 20 in the nation. Unbelievable. And that number is 561-616-1001, 561-616-1001, or look up francismedaesthetics.com. Kudos to you for this.
And I'm blessed every day, day after day. Every person after person that comes to Joanne Francis Medical Aesthetics proves that the science works.
Yeah, I would say it certainly passes every scientific test I know of when it comes to results. I see that in the mirror.
Yes. So the main objective of the Science of Skin Health Restoration protocols is to restore a healthy skin barrier function. Now, normal barrier function, in turn, increases skin tolerance.
Okay.
And skin should have developed a good level of tolerance before undergoing any rejuvenation procedures. For example, such as peels, lasers, microneedling, which at Joanne Francis Medical Aesthetics we do with your own natural PRP, which is platelet-rich plasma, just to name a few.
So we're talking about healthy skin barrier. And that's interesting to me because I tend to think of skin being a barrier to other things, but that skin also needs to be...
a protective layer.
It needs to be protected as well, though. So if we're talking about these unhealthy skin barriers and what that means to appearance and aging, what's the opposite of that? What's an unhealthy?
I'm glad you asked. The opposite of a healthy skin barrier, obviously, is a compromised skin barrier. And that means it can lead to skin disease, such as acne, either teen or adult, enlarged pores, clogged pores.
Sure.
And another compromised skin barrier, skin disease, is rosacea.
Okay.
Now, rosacea is a chronic and potentially life-disruptive disorder, which I am one of the lucky ones to have it.
Really?
Uh-huh. But it's primarily of the facial skin. Now, there is ocular rosacea, but that's in a different different category.
Yes.
Often characterized by flare-ups and remissions, and many have observed that it typically begins any time after the age of 30 as redness in the cheeks, the nose, the chin, or even the forehead, and it may come and go. Now, Dr. Obagi has great science in one of his newest products called Rosatrol. This product's science has made a significant difference in managing my own rosacea as well as many of my clients. The benefits of the science in Rosatrol is that it minimizes the visible symptoms associated with rosacea. It normalizes skin by reducing the excessive oil, which can lead to inflammation and diminish the appearance of the skin's redness. There is no cure for rosacea, but it can be managed, and I am so grateful he came out with this product.
Well, it certainly sounds like one. I know that rosacea is much more common than a lot of people think it is. It does come and go. And as you said, life disruptive was a really good word when it comes to that, because people can be embarrassed by it, and it's never easy to look different.
True.
And Rosatrol, wow, what a great benefit. Again, that number is 561-616-1001. That's if you're someone who does have the effects of rosacea, if you've got a loved one, anyone that might benefit from, again, not a cure, but something that can help to manage the treatment and normalize a bit.
And for men and women can cover up with makeup, but
Sure.
I'm going to go into a little detail right now about how that actually can make rosacea even worse.
Oh, okay, wow.
But there's also treatments for rosacea. We do the IPL photofacials to help diminish the vascular appearance of it.
Sure.
But it's, maintenance. It's all maintenance.
Gotcha.
So many times, Mike, when I sit with my first-time clients, either as a consult or prior to a treatment, and I ask them how they would describe their skin, many say my skin is sensitive. Well, sensitive skin just means compromised skin. Means that the barrier function is not functioning healthy. Do you remember W.C. Fields? Are you old enough?
Oh, yeah, absolutely. I mean, there was, the whole cigar, and that whole thing. It's a very classic look, and he was a wonderful comedian. But
Yes.
I know where you're going with this,
Yes.
I think.
His nose.
It was the look of it, the veins and everything
And the
else.
texture
it
and
was
everything.
very bright
so,
red. And
yeah, this was probably rosacea with him.
interesting.
But that's what makes me come to. I want to let people know some triggers to rosacea. That's sun exposure, extreme heat or cold. So even like if you're watching the Olympics, the cold weather can flare up rosacea.
Interesting.
Cosmetic products, as I was just talking about, including hairspray, stress, and alcohol, talking about the beverage,
Right.
and spicy foods.
Oh, boy.
But unmanaged rosacea can get worse, the appearance of it and the condition of it.
And that's so interesting because, again, some of these things are things that can be avoided just with some balance, but there are others that we're all going to have some stress. Most people, they use some type of cosmetic products. We're in Florida where it gets hot. So there are some of the variables here that are not necessarily just lifestyle controllable.
True. And choices in lifestyle, I'm still going to probably have a glass of wine with dinner on a Saturday night.
Absolutely.
Red wine is a little bit worse for rosacea, but now that I have my rosacea managed, it's definitely less visible.
And there you go. The management is really the important part of this.
Exactly. Note again, sensitive skin means compromised skin. Other signs of compromised skin, inflammation, which heat does attribute to.
Oh, sure.
You've seen people with red, irritated skin, usually apparent on the cheeks, which may not always be from rosacea.
Right.
And it could be the sun exposure. Irritation, which can be itchy, scaly, and burning. Dehydrated skin, as I talked about last week, how moisturizers aid in dehydrating the skin. And a healthy skin barrier functioning properly does not need external applied moisturizers.
And that is interesting too, because I mean, those external moisturizers, that's a whole industry in and of itself. I mean, I go shopping with my wife and I see all these out there, but they're really not necessary. You're saying if you have a healthy skin barrier, it's going to be in balance anyway.
Right. Not that you can't use them because
Sure.
it feels good, but you don't want to have to need them.
You don't want to build up that kind of a tolerance where your body has stopped producing its own.
That's the point, definitely. Which also is intolerance to cosmetics and skincare products, talking
Right.
about, again, what makes compromised skin. DNA damage, a breakdown of collagen, elastin, and skin texture changes. Remember we talked about the orange peel
Yeah.
look of women in their chin and
The
nose?
chin and nose areas,
Yeah,
yeah.
and men don't get it as much on their chin because they shave, which is
Right.
constant exfoliation. However, they do see it on the nose, like we were just talking about,
Sure,
W.C. Fields.
I've seen that, not as quite as badly with me, but I've seen some of the pores and some of the texture changes over the past couple of years. Sure.
That's right. Well, we were talking about every decade of the skin. Skin does become thinner. The breakdown of collagen, that's that cushion between our skin and bone structure. An uneven skin tone, brown spots, melasma, even ruddiness. That's the redness in the cheeks that I was talking
yeah.
about that might not be from rosacea. So at this point, I want to give some knowledge on that, which is what is the difference of all these brown spots, melasma? What is all that difference?
Right. A lot of, I'm not sure what melasma means. So let's find out.
That's what I'm here for. Because also, in order to treat the problem of the discoloration of the skin, it first has to be known what is the discoloration of the skin in order for the right protocols to be recommended.
There's not a cookie cutter response to any of
No, not black and white. Uneven skin tone has different looks. So we have freckles. Cute maybe when we're 6 years old.
this. My kid has them and they're really cute.
They're cute, but they can look aging as we get older. Freckles are small brown spots of pigment called melanin. Freckles are a result from genetics. That's why we see them a lot in young kids.
Right.
And while they can get darker much from sun exposure, the sun's rays fuel melanin production. All pre-existing freckles and moles should be kept an eye on every year with a bodily exam. Any changes in the moles or the brown spots, definitely why the exams are important.
Okay,
At
yeah.
Joanne Francis Medical Aesthetics, we have a special going on right now.
Okay.
Free mole check Fridays with our derm practitioners. So definitely call for your free cosmetic consultation for your mole check on Fridays.
And I think that's something very important to remember as well. And that is, we're talking about the skin and the appearance of the skin and the health of the skin itself. But because the skin, again, is the largest organ in the body, it affects the other organs too. So making sure your skin is healthy, having these moles checked is so important for your overall bodily health.
Exactly. Brown spots. They're from UV radiation.
Okay.
Exposure to UV radiation activates the melanocytes. That's the cells that produce the melanin. The cells that produce melanin help to protect the skin from sun's harmful ultraviolet rays by reflecting or absorbing them.
Interesting.
It is. However, cumulative sun exposure causes mainly all skin cancer. UV radiation is also exposure in tanning beds.
And that, again, that's a huge industry in and of itself.
Buyer beware, honestly. It is so dangerous, and not to be told that it is a better way. There's real good self-tanners out there that look very natural these days. Spray
Really?
on, and don't even have to be chemical.
Oh.
Yep. Then there is that word melasma.
Okay, great.
Okay, so melasma is brown discoloration of the skin, sometimes called the pregnancy mask. Also brought on by oral contraceptives. So melasma is melanocytes stimulation by female hormones, which the skin is exposed to UV radiation. So it is hormonally based, but the sun exposure will activate it, and it's the most difficult to treat, but again is also manageable.
That's so interesting because, again, we tend to think, or I tend to think anyway, not being an expert in the field by any stretch, that so many of these things come from outside. The sun exposure is a big part of it, but genetics play a part, hormone levels play a part, and that certainly shows why there's no one-size-fits-all treatment for them, because the root causes are all going to be different.
That's why the cosmetic consultations with Joanne Francis Medical Aesthetics, with me and our staff of specialists in the field, helps to give you the knowledge of what it is and then the game plan to go forward.
So important. Find out. Call 561-616-1001 and set up that free cosmetic consultation. Once again, francismedesthetics.com is the website. So yeah, we were talking about freckles and brown spots and melasma.
And it's all called hyperpigmentation.
Okay.
Melasma can also increase in patients with thyroid disease. Stress can also add to overstimulation of melanocytes and heat.
Well, it's a good thing I don't have stressful job in South Florida, which I think speaks for an awful lot of us.
Yes. When it comes to treatment strength can vary from mild to aggressive.
Okay.
And will vary depending on which form of hyperpigmentation that needs to be addressed, as well as also skin tone.
Okay.
And protocols will vary as well on different factors of each person's skin. So at Joanne Francis Medical Aesthetics, at your free cosmetic consultation, we will go over all options of combined therapy that is right for you and to address the hyperpigmentation issues.
Okay. What's
yeah.
the difference here between, I'm talking about a treatment strength, mild, aggressive? What's the scale there?
Strength is like if you get in your car, Mike, and you drive from Florida to California.
Right.
If you go 80 miles an hour or you go 40 miles an hour, you'll still arrive at your destination or your desired results. It's just lifestyle comes into play.
Sure.
Maybe work. We can take the slow route or we can take the fast route, but we do the end result is desired results.
So either way, you're going to get where you're going. And that's another great thing about how customizable it is, because it's going to fit into what your schedule is, what your tolerances are, what your budget is. I know we've talked about that in the past. That cosmetic consultation is really where it all starts. And again, the number to set one up is 561-616-1001 for your complimentary cosmetic consultation with Joanne Francis Medical Aesthetics Spa. francismedesthetics.com, once again, is that website. Set up that consultation. I think it's such a great thing.
When you come in for your consultation, there is no pressure. We are result driven.
Right.
We want to make sure that we give you the knowledge, which is free, so that you have the right path to know what you want to do and the results that you want to achieve.
It's so
Easy.
simple, but you don't see it as often. I mean, a lot of times, this day and age, people are looking for a very quick fix or a one-size-fits-all, or this is my problem, fix it now, or I see this red spot, give me something for it. But
it's
that's
old-fashioned
not what this is
customer
about.
care. Yes.
Yeah, you're not just going to take one look and say, I remember hearing a story, and I'm going to tie this in as a man to car repair. I remember hearing a story from a mechanic who worked at a particular shop, and he said a woman drove in, got out of her car, and said to the mechanic on duty, my truck's broke. Okay? And he said, sounds like a fuel filter to me. Instead of look, and that the mechanic who was telling the story quit and went to a different place because he said that's just not the way you do business. That's not how you address the problem. She's going to spend money she doesn't need to spend. She's going to have to come back and deal with those issues all over again. You've got to get your engine tuned up. You've got to get it looked from. I'm doing this again from a man's standpoint, but you've got to run the diagnostics to find out what's causing that knock or that ping.
It's true. Nobody wants to be ripped off in these days and times, and we're skeptical out there with cars, with everything.
Everything.
But again, during your free consultation, whether it is your consultation or even before your clinical facial with my staff or myself at Joanne Francis Medical Aesthetics, together we determine a program and a treatment plan, and it is based on lifestyle expectations and even budget to get you to your desired results.
How long do some of the treatments really take?
It can be anywhere from 2 to 3 months to 4 to 6 months approach, but do know that skin health is an ongoing commitment.
Well, I lost, again, another health parallels. I lost a lot of weight years ago. I lost about 80 pounds. And yeah, the initial losing it was one thing, but then it was an ongoing commitment to changing the way I ate, to maintain some exercise, to keep looking the way I wanted to look and keep my blood pressure good and keep my cholesterol levels healthy. That was the ongoing commitment. A lot of the heavy lifting happened at the beginning.
Right.
But after that, it was just maintenance.
And going back to your car analogy, you spend so much money. It's like your second biggest investment other than your home. And then what do you mean I have to maintain it? I have to get oil changes? I have to get tires rotated? We like to help you maintain your investment. So for many years, the care of skin issues have been focused on treating the signs and the symptoms of a person's skin issues and problems with their skin without correcting the cellular dysfunction underlying the condition. Again, that goes with cause and effect.
Yes.
At Joanne Francis Medical Aesthetics, we go a step beyond. We treat the cause and the effect. And again, we will also discuss options of combined therapy to achieve optimum results within office procedures and home care.
Okay.
I mean, people go home and see themselves way more often than I would see you or any of my staff in our office.
Sure.
So it is important that you take care of it daily rather than have to wait next month to say, hey, now what can I do?
And I've got to tell you, I mean, even just some of the minor things I'm doing with you. At the beginning, I'm like, really? I've got to do this rinse and then this scrub. It takes me literally about 2 minutes total in the shower in the morning, and then before I go to bed, it's nothing.
I heard that it takes 6 weeks to form a habit or 6 weeks to break a habit.
Yes.
I'm
I've
so
heard
full
that
of
too.
different tidbits. I mean, I don't know
Isn't that
where they
fun?
come from. Yeah, it is.
6 weeks or 24 repetitions. I've heard all kinds of things.
Okay.
But but these are habits that are worth building.
So another note, treatments in home care can be also done on the neck, the décolleté, which is the women's chest area, and hands, along with the face.
All right.
Because these 4 areas, they can give away our age. And a woman does not give away her age. So we don't want our face, neck, décolleté, and hands to give it away for us.
And how often do you see that? You see that a lot. I see that a lot. You see someone who has, their face looks like 20 years below their age, but their hands are a giveaway, or that neck so often, but there are treatments for all of it. You can have the whole picture.
There's so many things that are offered out there that is so unbelievable to reverse the signs and the appearance of aging in all those areas. And again, it's for men and women.
Right.
So this is what led to many years spent by Dr. Obagi studying and developing the science of skin health and his ongoing work.
Now, it's so important, and we're just about out of time. actually, which is amazing to me because this flies by so much. And I want to quickly give a little more information. I have a question for you about something you mentioned last week. To get that consultation, that cosmetic consultation, it's a complimentary consultation. Call Joanne Francis Medical Aesthetic Spa, 561-616-1001, 561-616-1001, or visit francismedesthetics.com. Or if you have a question, you'd like something that you would like us to cover on a future show, you can send it right to Joanne at Joanne, Joann, at francismedesthetics.com. Now, last week we talked about a whole lot of things, obviously, but you mentioned something that sounded really cool to me, and I loved the name too. It was called 3 for Me. Tell me a bit about that.
3 for Me is an incredible package put together. I can't express enough the great results that our clients are experiencing from the 3 for Me treatments. It addresses those broken capillaries, brown spots, called IPL photofacial,
right,
and the non-ablative skin resurfacing for fine lines and wrinkles. So, and for men and women. But it's not just to the face. It's also for the neck, the décolleté, the hands, and the body.
All those giveaways.
Yep.
Really. Well, call and find out if that might work well for you. I mean, that sounds like it's got a pretty wide range of benefits. So the 3 for Me is fascinating, but all of it is. There's so much you can learn. Get that free cosmetic consultation with Joanne Francis. Call 561-616-1001 or visit francismedesthetics.com and send your questions to Joanne, Joann, at francismedesthetics.com. The time flies by, Joanne.
It does. And next week, the 6 key principles of skin health restoration.
Good. So we're continuing this wonderful conversation about this. We'll get those 6 key principles. 561-616-1001. It's been another really great edition of The Science of Skin Health here on Legends 100.3. Mike McGann, along with Joanne Francis. Thanks so much for being here, Joanne.
Thank you. Have a great week.
You as well. Thank you for tuning in. Lots more legendary programming on the way.
Thanks for listening to The Science of Skin Health on Legends 100.3. To learn more about how Joanne Francis Medical Aesthetics Spa can help you put your best face forward, set up your free consultation today. Call 561-616-1001 or visit francismedesthetics.com. See the difference Joanne Francis can make. Tune in next Sunday at 7 for another edition of The Science of Skin Health right here on Legends 100.3.